Hello, my name is Sarah Bergen. I am the Assistant Nurse Manager of Operations at Highland Hospital in Rochester, New York. Highland is affiliated with Strong Memorial Hospital and is part of a wider medical system that is called the University of Rochester Medical System. And in this presentation, I would like to talk about some focus points. And the focus points are the different roles and responsibilities of an informatics leader, informatics nurse, and a privacy officer here at Highland Hospital. The use of electronic health record system that we do have in place, technological innovations used in the surgical setting, a reflection on these technologies, and of course a reference page. So first, our first interview was Donna Bernard. Donna Bernard is our Director of Healthcare Information Management. Her primary roles are to review the revenue cycle, the health information management, and utilization management. Throughout her day's work, they get roughly about 450 requests a day, and that comes from all of our different affiliated hospitals, so Highland, F.F. Thompson, and Strong Memorial Hospital, for medical records that come from attorneys, insurance companies, and other healthcare facilities. Once they review these records, they ensure that the records are HIPAA compliant. Other departments she works alongside include release of information, coding, the scanning team, which is just the scanning of all the electronic health records, and the data integrity team. The data integrity team is the security of eRecord, and they help fix wrong charts and get providers situated with their NPIs. The next interview was with Shana Held. Shana Held is our HIPAA privacy officer at Highland Hospital. She also oversees Highland Family Medicine, which is one of the off-site locations. Day to day, she does multiple audits, checking charts that have been inappropriately accessed, and she kind of researches on that. She addresses HIPAA violation concerns, and if there is a violation or concern, the integrity hotline is usually called, and Shana's role is to investigate. Her steps for investigations include exporting those audits, investigating and documenting on those audits, sending the findings to Human Resources, who then investigate the employees with an interview process. Shana is able to provide education for new staff entering into Highland Hospital and has meetings with department managers and the HR representatives about every 2 weeks to review any open or new concerns. So in this day and age, social media is really very popular amongst all generations, but mostly the millennials and the younger generations. Seems to be the most popular way of communicating amongst each other and receiving information, especially off of the internet. So Shana's job is to investigate HIPAA violations related to social media by reviewing their accounts and making sure no patient information was released. For example, Shana had gotten a complaint that an employee was taking pictures of a patient and posting it on social media. She then has to investigate the accusations and report any findings to HR for immediate follow-up if in fact that was needed. Our next interview was with Sue Simeone. Sue Simeone is our informatics nurse. She used to be called the clinical architect, but her role is definitely more of an administrative role currently. There's leadership when it comes to technology. Her role is to advocate for nurses, the educator, and help gets the word out to help roll out changes. So, for example, we just had a recent addition to the Alaris pump integration system on the nursing floors. Sue's job was to attend the monthly management meetings with all the nurse managers, and she talked about the important points of the pump, answered any questions, and really talked about the planned rollout on each unit. She also attends the Nurse Advisory Committee that's comprised of Flora units and helps make decisions and discusses what they think about the eRecord changes and helps with the decision making of any upgrades to the eRecord system. Sue's most recent challenge has included the eRecord Go Live That's at one of our affiliated hospitals, FF Thompson. Her role was to really help coordinate the difference in practices between each facility that are highlighted by all using the same electronic health record. Ultimately, Sue has been a wonderful resource for advocating for nurses to help make our electronic health record system easier to use, increasing the satisfactions with the program for our nurses. So that's it for our interviews. Now I'd like to talk to you about the EHR that Highland uses. The electronic health record system that we use at Highland is called eRecord. It is a fully integrated electronic health record system. It is powered by Epic, and it focuses on improving patient safety and quality of care by serving as an important way to connect with our community and our providers. This is done by the streamlining of communication between hospitals and outpatient clinics. So again, the University of Rochester Medical System is a very large system, and eRecord is able to communicate with all of the affiliates within the system. So the ease of the use with the EHR is done by bringing all of the patient information together in one location, including lab results and imaging, ED, consults and inpatient progress notes, medication lists and discharge summary and instructions, and really so much more. There are two types of access to eRecord, and this access includes full access and a view-only access. ePartner is a great feature for those other facilities that need access to the information for review, but don't need to make any additional changes into the patient's chart. Some of the eRecord features that are really great, Windows has a navigation system. There is classroom training that's required for all to use eRecord. Most PCs with standard operating systems can access eRecord. Two-factor authentication and a streamlined security connection to eRecord. The eRecord partner features, they have the same thing, a Windows-like navigation system, a customizable inbox alert system. A brief 20-minute e-learning is required before using the ePartner. And again, most PCs will work with that, and they also have a streamlined secure connection for the ePartner. So just to name a few of the advantages of eRecord with Epic. So with Epic, there's a better flow of communication between disciplinaries, and each discipline has a different view of eRecord that is better equipped for their need. Like Sue, our informatics nurse, said, nurses are able to help and build the program. Throughout the startup of the system, many nurses were hired as eRecord builders and trainers once the program was launched. There are many benefits to having nurses in the front line when teaching this information due to their knowledge of documentation and practice in the clinical setting. Another advantage is the two-factor authentication. It's a requirement of all the URMC faculty, staff, and vendors and community partners to ensure privacy and patient information. Lastly, standardizing the workflows and boosting the efficiencies by eliminating redundancies in testing, data gathering, and transcribing are all advantages to eRecord. Some of the disadvantages of eRecord include the use of multiple medical record numbers when visiting multiple facilities. So currently, they are working towards getting each patient one e-number versus what they have now, which is a medical record number, and they're different for every facility. Another disadvantage is it's too easy for employees to look at inappropriate charts. More restricted access needs to be available. So there are systems in place called the Break the Glass, which requires you to sign in again if a chart is accessed that is under certain restriction or normally wouldn't be accessed under your name. This information is sent to Shana, our privacy officer, for review. Privacy and confidentiality is so important when looking into electronic health record systems. Patients are very vulnerable, and they deserve the safe environment and protections that we can give them. Highland's eRecord system provides this privacy and safety by a two-factor authentication sign-in, requirement of enrollment, and the use of the VPN connection. So when you walk into an operating room, you're surrounded with evolving technology. All technology put into place to increase the quality care of our patients. They range from anesthesia machines, microscope, diagnostic equipment, and patient safety equipment, all there to improve the patient's experience. Although the technology within the operating room is very overwhelming due to the vast amounts of machines and different equipment, it is essential that we as nurse managers have a plan for keeping the operative team competent throughout in-services and multiple educational opportunities. So let's talk about just a few pieces of equipment that are used frequently throughout the operating room at Highland Hospital. First, we have our sequential compression device, also known as the SCD machine. This device helps prevent circulatory conditions, most commonly DVT in the lower extremities. It works by inflating and compressing the lower extremity starting at the ankle and working its way up the leg, reducing numbness and moving fluid away from the area. This machine is imperative for patients undergoing general anesthesia and who are immobile for certain lengths of time. For patients that have larger calves, they do have foot massagers that do the same function. These devices follow the patients to the post-operative area and to the medical surgical floors until they are up and moving around independently. This device is part of our timeout during every surgical procedure to ensure that every patient has one and that it's turned on before incision is made. This is our NeoProbe machine, and this was introduced in the early 90s. The sentinel node market experienced high growth with cancer findings in the breast. The NeoProbe was created to assist with sentinel lymph node staging. Before the surgical procedure, patients receive a quick procedure that injects a radionuclide dye that is attracted by the lymph node system, making them easier to find it when they're surgically removing cancerous lymphatic tissue. The sentinel node is also called the drainage node. It is usually the first lymph node that breast cancer moves into. So by utilizing this NeoProbe to help locate this node for removal and sent for rapid pathology reading, surgeons are able to make confident decisions on whether more nodes need to be removed. If the sentinel node is shown to be negative for cancer cells, patients are able to decrease their risk of developing lymphedema because less lymph nodes are taken out. This is our Hologic Trident specimen radiography system. It allows for rapid specimen verification. It does this by breast tissue imaging by incorporating a microfocus tube, unique specimen imaging processing, and direct digital detector. The results are high in quality and reliable when checking for margin verifications with breast specimens. This system is mostly utilized for needle localization and breast biopsies. This is our Cook Doppler internal Doppler. Throughout microsurgery, and microsurgery is with very small vessels and very small instrumentations, usually using microscopes for visualization. Vessels are often clamped and reconnected together, whether it be a vascular procedure or a plastics reconstructive surgery. Oftentimes it involves the connections of a free flap. The term free flap refers to the wide cutaneous area that needs to be covered, so tissue from another area of the body needs to be disconnected and reconnected with the existing vessel in the area to create a functional flap and well-perfused piece of tissue. This monitor goes right around near the anastomosis to make sure that perfusion is working. And this probe stays in place until discharge, and it has helped to show about 81% in flap salvage rate. So the last 4 technological innovations are just a few that are used throughout the surgical suite to improve patient safety and quality of care. Copeland, Lanzafame, and Coleman said it perfectly by stating that the improved integration of high technology and coordination among services and providers and staff is essential to improve efficiency, enhance safety, and reduce the cost of care. During this project, I have been enlightened and learned that informatics is all around us. I wasn't fully aware of what informatics consisted of. But having now learned that involves not only daily equipment of electronic health record, but as well as the people around it, making sure patients get the safest and best quality of care possible. As the assistant nurse manager of operations in the operating room, I believe my employees will only be able to provide the safest and best quality of care to our patients if they are well knowledgeable and competent in the work of health informatics. As their leader, it is my job to enlighten them and teach them the importance of electronic health records and all the resources we have at our fingertips to teach them about health informatics.